Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today we're taking a quick look at special enrollment periods on Health Reform's Marketplace. You know, open enrollment has officially ended for folks to get coverage for 2017. It ended on January 31st. Now, if you want to buy private insurance on the Marketplace at Healthcare.gov, you can only do so if you qualify for what's called a special enrollment period. The triggering events to see if you qualify are what are called qualifying life events. These are obvious things. You had a loss of health insurance, either because you lost it through your job, you had COBRA continuation coverage and that ended. You didn't drop it, it ended. You lost Medicaid for maybe a reason of having an income change. If you lost other insurance, you can then go to Healthcare.gov and apply for health coverage. Maybe you had a change in household. Maybe there was a marriage or divorce, birth of a new baby, or an adoption. That is a qualifying life event. Maybe you changed residence. Maybe you moved. There is a qualifying condition to this one. You would have had to have had insurance at least one day in the past 60 days. There was a fear by some insurance companies that people were moving just to gain access to a special enrollment period. That fear wasn't necessarily founded, but it did change the administration of this particular quality for qualifying life events. Other events such as leaving incarceration, becoming a new citizen, or coming into status that allows you to gain Marketplace coverage for the first time, those are also qualifying life events. How do you apply for coverage? You go to Healthcare.gov, just like you would if you were during open enrollment period. You're going to answer a few questions to see if you qualify. You'll click on the green button to get started, just as if it was during open enrollment. It's going to ask a couple questions to see if one of these qualifying life events has happened. And then you will go through the application process, setting up an account, previewing plans, selecting a plan, and paying your first premium, just as if it were during open enrollment. You can also do the same process over the phone by calling the Healthcare.gov call center. If you do call the call center, make sure you identify that you're asking about a special enrollment period. You don't want to get shut down right away by saying you're just shopping for insurance. They're going to inform you that open enrollment has closed. You want to identify that there's been a change, you're asking for a special enrollment period, and you would like to begin the application process. Now, I always want to remind people that there is no such thing as open enrollment for programs like Badger Care Plus and Medicaid. You can apply at any time, and you can actually apply for those programs using Healthcare.gov as well. When you log in to Healthcare.gov and click the green button that says I would like to apply for healthcare coverage, it will actually ask you if you're applying for a special enrollment period or if you are seeking Medicaid or CHIP, the equivalent of our Badger Care Plus in Wisconsin. You can click that box right away. Even if you're just filling out a regular application, it's going to assess you for Badger Care Plus or Medicaid anyway, but it does give you that option right on the front page to identify that you're there to apply for Medicaid or Badger Care Plus coverage. You can visit this Healthcare.gov link right on our website. You can click the information button to get that, or you can send us an email and ask us more questions about special enrollment periods and qualifying life events in 2017. Thanks for joining us.